Hey there, health enthusiasts! Today I'm diving into a topic that's as fascinating as it is crucial: autoimmune diseases. These conditions occur when the immune system, which normally protects us from harmful invaders, starts attacking our own body's healthy cells and tissues. So, what exactly are autoimmune diseases? In a healthy immune system, the body can distinguish between its own cells and foreign invaders like bacteria and viruses. But in autoimmune diseases, this distinction fails, leading to inflammation and damage in various organs and tissues. Let's talk about some common types of autoimmune diseases. First up, we have rheumatoid arthritis. This one affects the joints, causing pain, swelling, and stiffness. Then there's lupus, or systemic lupus erythematosus, which affects multiple organs including the skin, joints, and kidneys, often causing a characteristic butterfly-shaped rash. Next, we have multiple sclerosis, or MS, that affects the nervous system, leading to symptoms like muscle weakness, vision problems, and coordination issues. Type 1 diabetes is another big one. It attacks the insulin-producing cells in the pancreas, causing high blood sugar levels. Hashimoto's thyroiditis and Graves' disease both involve the thyroid gland. Hashimoto's leads to hypothyroidism, or low thyroid hormone levels, while Graves' disease causes the thyroid to produce too much hormone, leading to hyperthyroidism. And let's not forget celiac disease, a reaction to gluten that damages the small intestine lining. Symptoms of autoimmune diseases can vary widely, depending on the specific disease and the organs affected. Common symptoms include fatigue, joint pain and swelling, skin rashes, fever, digestive issues, muscle weakness, and nerve problems like numbness and tingling. Now, what causes these diseases? The exact cause is often unknown, but several factors may contribute. Genetic factors play a role. Family history can increase the risk. Environmental triggers like infections, chemicals, and certain medications might spark an autoimmune response. And hormonal factors are also at play, as some diseases are more common in women, suggesting hormones might have an impact. Diagnosing autoimmune diseases can be complex and often involves a combination of medical history, physical examinations, blood tests, and imaging studies like X-rays, MRIs, or CT scans. When it comes to treatment, there's no cure, but managing symptoms and reducing immune system activity is key. Medications like anti-inflammatories, corticosteroids, and immunosuppressants may be prescribed. Lifestyle changes such as diet, exercise, and stress management can also improve overall well-being. Physical therapy helps improve function and mobility, and supportive therapies like counseling and support groups can provide emotional support. Living with an autoimmune disease often requires a multidisciplinary approach, including regular checkups and communication with healthcare providers. Patients may need to advocate for themselves to get the care and adjustments in treatment they need. In conclusion, autoimmune diseases can significantly impact quality of life, but with proper diagnosis, treatment, and support, many individuals lead fulfilling lives. Awareness and education about these conditions can help improve understanding and management for those affected. If you suspect you have an autoimmune disease or have concerns about symptoms, it's important to consult a healthcare professional for evaluation and guidance. Thanks for watching, and stay healthy, folks.